on coronavirus. So today I'm going to talk about busting myths about COVID-19. I am Dr. Siddharth Ramesh Babu. Thank you everyone for this wonderful opportunity. So what is COVID-19? It is a virus which belongs to a family called Coronaviridae. It is called as novel coronavirus because it is only 6 months old. It's also called as SARS-CoV-2. So as this virus is only 6 months old, new information about this virus is accumulating on a daily basis. So we are all aware of this timeline between December 31st, where the first case of pneumonia was reported in China of unknown origin, and March 11th, where WHO declared this this disease as a pandemic. So we're all aware of this timeline. So I'm not going into detail, but a point that I would like to highlight is this point by WHO Director General Dr. Tedros on February 15, 2020, where he made the statement, we are not just fighting an epidemic, we're fighting an infodemic. So what is an infodemic? An infodemic is an excessive spread of information. Now we're in the era of social media. Because of this, any information that spreads, it spreads rapidly, and it multiplies the rate of spread. In an infodemic, most of the information that reaches people is false. So because of this combination of an infodemic with social media, we are now living in a time where misinformation goes viral. There are a lot of issues regarding misinformation. So I will be delving into few of the common issues. Wrong and harmful health advice, probably the most harmful issue about misinformation. Like for example, people have knowing that alcohol can be used to sanitize the hands, they have consumed it in excess, and people have died from excess consumption of alcohol. So statements regarding consumption of disinfectants, people have expired, sometimes people have self-medicated themselves with hydroxychloroquine, not knowing its properties, and expiring as well. So there's a lot of wrong and harmful health advice due to misinformation. So wild conspiracy theories occur. Like for example, few people think that viruses can spread through 5G mobile networks. We are aware of these WhatsApp viral information, like combining water with vinegar and salt can cure coronavirus. All this is wrong. Another famous theory is that you can self-diagnose yourself by holding your breath for 10 seconds. So all these type of theories are wrong, and it gives people a false sense of hope or false sense of reassurance. Also, there can be a spread of hate. In a few places, it has been said that African Americans and women increase the spread of COVID-19. This is absolutely not true. Coronavirus equally, every single citizen in the world is equally susceptible to the virus. So another important misinformation issue are mental health issues. Increase of 40% in mental health issues in the month of April in India was noted. Even in the WHO, many such reports have been reported. So why does all this misinformation occur? It occurs because we humans want to be well informed about anything. So because this virus is new and we are learning information about it only on a daily basis, whatever information we receive, not checking the facts, we spread it. That is how this misinformation occurs. So now I'm going to bust few common myths about COVID-19. All of this information is available on a number of websites. So I'm going to share with you what is available in the World Health Organization website. So a very famous myth, anti-malarial drugs, mainly hydroxychloroquine, is a cure for COVID-19. This is not true. As of now, there is no drug which can prevent or treat COVID-19. Though there have been good reports of this drug, it has not been proven as of yet. Pepper and garlic, can it prevent COVID-19? No, it cannot. These are immunity boosters. They will not help prevent COVID-19. Can COVID-19 be spread through houseflies and mosquitoes? No, this virus is a respiratory virus and can only spread through droplets of saliva or discharge from the nose. That is why the measures of keeping social distancing, adequately cleaning your hands with sanitizers or washing with soap or water, and wearing face masks is very important. Another myth which spread like wildfire, that this virus dies in the summer heat. This is not true. Reports have showed that strands of the virus can even survive at 60 degrees centigrade, which is above 140 degrees Fahrenheit. So it can survive even at that temperature. There are a few places which have talked about UV lamp sanitizers. So because of this, a lot of people have had damage to their eyes and to the skin. So you should not use this as a method of sanitizing. You should use soap or water or hand sanitizers only. Can thermal scanners or thermometers detect COVID-19? No, they can only detect fever, which is a symptom of COVID-19. It cannot detect the virus. Another one which causes a lot of fear and panic: old people are more susceptible to the virus. This is not true. Everyone is equally susceptible to the virus, but in people with higher age and with multiple health issues, they can get a more severe disease. Another myth: you will die if you get coronavirus. I would like to reassure everyone, 80% of the people with coronavirus generally have only mild symptoms, which improve in a week or two with self-isolation. Only 20% need hospitalization, 5% will need ICU care, and there is only a 1% death. So I would like to say, don't be afraid, and at the same time, we should not be careless. So how do we overcome this infodemic? We need to believe only reliable sources of information, like the information we get from the World Health Organization or the Argue Setu app. Do not believe social media posts. Avoid sharing unless the fact is true and checked. Avoid being anxious. This too shall pass over a period of time. Whatever information we do receive, we should handle the information rationally and with a little bit of common sense. The only way to overcome this infodemic is by together. The change starts with you. So in conclusion, I would like to say, check all your facts before sharing, follow updates only from standard websites, and don't be anxious. Thank you very much. I'm Dr. Siddharth Ramesh Babu. For orthopedic queries, you can contact me at the OPD app by 1mg or on this link on Google Chrome. Thank you. So I'm open to questions.
Thank you, Siddharth. That was very informative session. And if anybody has any questions for